Hey, and we're back. I'm your host, BKP, from beautiful downtown Blue Ridge, from Blue Jeans Pizza here. Beautiful Friday morning, every Friday morning. And it is time for our segment. We thank the Georgia Cancer Specialist for Ask the Doc with Dr. William Whaley. Now, before we get started, don't forget, 8:45, Congressman Doug Collins is going to be calling in, and we're going to ask him directly what is really going on in Congress, because can't get the media to tell us. Maybe he'll tell us what's happening. Dr. Whaley, how are you this morning?
I'm great. You ready?
Yeah, I'm ready. That's right.
All right. Okay. Now, we all got to have something.
Yeah, that's what I'm saying. I'm clearing out of the way.
Semi off the wall. You're going to have pet of the week.
Yes.
You remember we were talking about the Campylobacter jejuni fetus epidemic.
Yeah, how could I forget that?
Yeah, last week, which now actually has 75 patients in 12 states. But the reason I brought up the pet of the week this week is, you know, I'm always supporting the pet of the week. Have you heard about people taking sick leave when they're nursing their sick pet? Now,
no.
Okay, well, you know, the world's full of crybabies, and I think some of this family leave business is a little bit excessive, and how can a guy who's got a factory and he's trying to build something work into his overhead and everything else? Some guy's going to take off 6 weeks, call it maternity leave because his wife's pregnant. You know, I mean, I'm too old for that. It doesn't get me. But when I found about that lady in Italy who got to go out on sick leave to take care of her sick puppy, I said, I just hope this these people in this country don't learn about that, because, you know, Italy's a socialist country, but I just can't imagine giving people industrial business sick leave to care for a sick puppy. It just, and I've got 3.
No, that one I didn't hear.
And Jane's taking one of our puppies to get fixed this morning. But the sick leave part I thought was excessive. You shouldn't raise your overhead on your automobile construction because somebody's got a sick puppy, right?
I didn't. That one I didn't hear. I'm going to have to look that one up.
You didn't hear about jejuni fetus last week. I mean, I got to have something new for you every week. All right.
That one's new.
All right.
We're going to get right into the questions this morning.
So I can get out of the way for Doug.
No, we're not getting you out of the way.
I love Doug.
We just want to make plenty of time for everybody this morning. Okay, every week I get the questions, and I have to think about them for a minute, and then let's just go. Is loss of taste and smell normal with aging? Is it normal with aging to lose taste and smell, or could loss of taste and smell be from other causes?
Okay. Now
I like that question.
All right. Well, we did smell a few weeks ago, if you'll remember, and I talked about polyps and allergy and infection and all that. We're going to stay away from that today. But you want to put that chart up on the TV there. There's a chart there that's got, you won't be able to read it very well, but I put it up there because it's overwhelming. And I'll just quickly read a few of the things that are on there that can cause you to lose a sense of taste. Bone marrow transplant, Crohn's disease, exposure to chromium, cirrhosis of the liver, depression, hemodialysis, meningitis, multiple sclerosis, pernicious anemia. That's just a few. It's on and on and on. We're not going to talk about any of that today. So you can pull that big old chart down after everybody's had a chance to look at it. So yes, there are a lot of diseases interfere with the sense of taste and the sense of smell. It just so happens this question was sent to me Wednesday instead of Thursday. I like it coming Wednesday, by the way, because my wife had people last night. So as I'm looking at that, I ran across a study that was released on Monday. So this was a very, very topical study. And here's the story. First of all, how do you define the sense of smell? Doctors don't test for the sense of smell. You've never been to a doctor's office where they tested you for smell. I did learn that you could take, we had coffee in a little vial, we had peppermint in a little vial, and we had orange extract in a little vial when I was on the neurology service taking a elective. But the average doctor doesn't test for smell. At the University of Chicago, they did a study on 3,000 adults age 57 to 85. Now the question says, are these lost with aging? So this age group of people is 57 to 85, and they gave them 5 smells to discern. Peppermint, that's pretty, that's pretty easy to listen to. Fish, people could smell fish. Orange, that's the citrus thing we used to get. Rose, and leather. Now you would be able to discriminate those 5 things. So they measured them, and 5 years later they went back and measured them. All right, now, of that group of people, so that was a big group, 57 years old to 85. Well, I'm 77, you're 36, but you're getting a little older, 39 maybe you are. Okay, so this sense of smell, if you had only been able to determine 1 of 5 of those when you were tested the first time, and they went back 5 years later, you had about a 30% worse chance of having developed Alzheimer's disease in that 5 years. So somehow or other that sense of smell was linked to deteriorating intellectual capacity and the development of Alzheimer's. If you had gotten, say, 3 or 4 out of 5, you had a higher rate of Alzheimer's, but it was directly proportional to how many you had missed. So if you got all 5, that rate of Alzheimer's was here. If you got 3 out of 5, that many got Alzheimer's. If you got 1 out of 5, that many got Alzheimer's. So the sense of smell in some fashion was linked to the development of Alzheimer's. No cause and effect, just a linkage. So the answer to the question is yes, sense of smell and taste deteriorates with age naturally. If it deteriorates with age to a greater extent than average, it may be associated with some diminishing brain function. And the hooker was that the sense of smell and the sense of taste are at the outside of linkages to the centers within the brain, and therefore, I don't want to say pollution, but influences that are in the air and in what we taste can get to the nerve and then get to the brain kind of like it was going down a highway. So nobody has figured out exactly why that is, but it was a very interesting finding. And so the answer to the question is sense of taste and sense of smell does deteriorate with age, starts doing so in the late 40s and early 50s. And if it seems to be worse in you than somebody else, it might mean that you've got some sort of a degenerative disease going on. Not anything on that big old long list there, however. But there's nothing you can do about it. There's no treatment for it, and it's a statistical thing, and forget about it. But that's the answer to that question. Oh, and the thing about the smell, remember, most of the smell stuff is common. We've got the ragweed out now, and we've got the goldenrod out now. And smell is polyps, infection in the nose, allergy, maybe dental, maybe sinus, but that's generally related to some sort of thing that can be fixed.
Well, the ragweed's out. That I know for a fact because the bridge of my glasses, my eyes are watering, and I can't stand to have.
Remember there, it's Zatador and Alowac or whatever. You go to the pharmacy, and the A farthest to the left, A, and the farthest to the right, Z, on the eye drops are the same drug, and get the generic one, and it says for eye allergy, and put 2 drops in there twice a day, and your eyes will be as good as they're going to get. It may not be totally normal. Zatador.
Well, that ragweed has been bothering me, but I have found a cure for it. It's called cigars and baseball.
Yeah, and stay in the house.
Yeah.
Turn on the air conditioning, all right.
Can a person's medical condition or illness cause a change in their personality and behavior?
This really sounds like a simple question, doesn't it?
Well, yes, it does, and
But yes. I want you to think about how much of a difference those two words are: personality and behavior. And so I'm going to split it and focus on the two as separate. Personality, no. The personality disorders, so to speak, are very serious psychiatric disorders, and I'm not going to try and build a watch here, but the medical community divides personality disorders into three categories. Category A, or cluster A, people appear odd or eccentric. So stop and think about the people that you know that are odd or eccentric, and then the medical terminology for that is schizoid or schizotypical. Nothing about a medical condition affects that. That's a personality disorder. The second group of personalities, cluster B, are people who are dramatic, emotional, or erratic. Now, we know people who have behaviors that are dramatic, they're emotional, a lot of those people go down there and act at the theater or something. So where that becomes disease is narcissistic, antisocial, borderline personalities, and that's kind of where you find the psychopaths and things like that. Medical illnesses don't cause that. The third group of personality disorders are people that appear anxious and fearful. Well, we know people who are kind of afraid to go outside. I don't want to fly because I'm afraid they're going to blow up the airplane, or, you know, that's socially acceptable. My wife has those. But you know people whose personalities are anxious or fearful. Where you get into the psychiatric end of that is avoidant behavior, where they don't do anything. Obsessive compulsive, the people like, you know, they wash their hands all the time, or they'll come in here with a handy wipe and wipe this thing up even after the people have done the thing wiped up, or very dependent. They can't do anything for themselves. So I will say that, to get the personality thing out of the way, nothing about a medical condition affects those personalities. Now, behavior, lots of medical things. Low thyroid disease makes you sluggish. High thyroid disease makes you hyperactive. That's behavior, not personality. Testosterone. You remember we're talking about testosterone replacement therapy. Everybody remembers the weightlifter, wrestler in Atlanta who killed his wife and then wrapped a weight cord around himself and dropped the weights and killed himself. Testosterone can make people hostile, angry, and mean. So that if the disorder is that you are making testosterone in a tumor or taking extra testosterone, that's your behavior, not your personality. If you remember that President Kennedy had Addison's disease, his adrenal glands didn't work, and those people, their behavior becomes sort of subdued, their energy goes down, they're liable to infection and stress, and he took cortisone all of his life. And then lastly, hyperadrenal, kind of jittery or so forth, and that medical condition, that's again behavior, hypervigilant, hyperactive, hyper alert. Adrenaline is fight, flight activity, and so those types of medical conditions affect your behavior, and then the personalities are not affected by your medical condition. Is that good enough?
Yeah, because I will tell you this, I like the way you divided, because it at first it did sound like a simple question, and I like the way you divided personality and behavior, and I didn't think of it that way. And that's, I mean, you made it very clear. You made it very clear the difference in personality and behavior. I'm just getting over a cold, and my ears feel plugged. What causes this? Is there any remedy for stopped up plugged ears? Okay,
this is it's a good question this time of year because of the ragweed. I had a picture that I was going to show. technology is not, I'm not much technology, so I didn't get that picture. But when you have a cold, or when you have the ragweed, you've got you got a stuffy nose, you blow your nose. The eustachian tube that drains the ear, when you're scuba diver or something, you have to pop like that. So the most common thing is your eustachian tube is full of inflammation caused by a virus and not by ragweed, and then your ear can't equilibrate the pressure. And so you go, chew gum, blow your nose. And that's the most common causation of it. And the non-sedating antihistamine or the nasal sprays that are all over the counter can open up the eustachian tube. But, and this is specifically, I have a cold and I'm getting over it. So I want to stick to the fact that this occurs acutely related to a cold. Now, the most common stuffed ear that isn't related to this getting over a cold is waxing ears. And you can't look in there and you can't see it. And people take Q-tips and stick them in their ear. We used to say in medical school, don't stick anything in your ear any smaller than your elbow. Meaning, don't put a paper clip in there, don't stick a matchstick in there, don't stick a Q-tip in there. And if you're going to stick a Q-tip in there, you need to just do it on the outside to get it dry. And if you've got wax in your ear, you got to go to the pharmacy, or you can go to your doctor and have him look in there and say you got waxed ear, then he'll send you to the pharmacy. And the pharmacist has 2 or 3 things over the counter that he can give you that you put in your ear, it melts the wax, you get into the shower, and you let hot water run in your ear. So that type of plugged up ear, not associated with the cold or with the allergy, the pharmacist will help you do it with the products over the counter. But I want to really caution people that stuffiness after a cold is not a joke. If you go on an airplane ride and you don't carry with you Afrin or something, take Sudafed or one of these over-the-counter Claritin D, if it says D, it's a decongestant. When you come down from altitude, you can rupture your eardrum. Jane has actually ruptured her eardrum in an airplane because she used to have a whole lot of allergy sinus problems. But on the inside, so here's the eardrum. There are all those little bones. These bones connect at the skull to a thing called the oval window. And if your eardrum, which is a little bit thicker, doesn't rupture, and that oval window ruptures, you may have a lifetime of dizziness that can't be fixed. So it's not a joke. So if you're stuffy after the flu or the allergy, it's over-the-counter non-sedating antihistamines with or without the D. It's the non-prescription nasal sprays. We don't have any of the prescriptions anymore to open it up. And then once you know you're opened up and the air is flowing freely, if you still feel stuffy, you got wax in your ears, go to the pharmacist.
Well, when I fly, when we start to descend for landing, I'm embarrassed to say how I look with my chewing of gum. But okay, I chew the daylights out of gum coming down.
Have you ever scuba dived?
Yes, one time. Okay. One time I did one time.
Okay. Well, you can easily learn to clear your ears when you scuba dive, because if you don't, you're going to rupture your eardrum. And people who don't have the ability to clear their ears, or who have nasal allergies and so forth, we tell people to avoid Afrin and Afrin-like nasal sprays because they make you breathe so good that you get hooked on them and you want to use them every day. When you're going to be using a nasal drug like Afrin, you stop in 3 days, and then you say, okay, I sure did breathe well for 3 days, but doc said I got to quit. Because otherwise the nasal mucous membrane gets used to it all the time. Well, I tell people with this problem, you stick with your passport or with whatever else, whatever kind of traveling you're doing, a bottle of Afrin and some Sudafed or Claritin D or something that works quick. And about an hour before you start to descend, you take that drug, the Claritin D or the Sudafed or whatever, if you ask your pharmacist, take it. And then hour to 30 minutes, use that afrin and get your airway open before you start down, because if you start down and you're not really good at it, you could be miserable. One of those eardrums can rupture.
Oh, I have.
But you don't want to, when you get that bad, I mean, the ruptured oval membrane, no family practitioner, general internist even knows what that is. I was a flight surgeon, you know, when I was after Vietnam. So I know about the ruptured oval membrane because of flight surgery training, and I also made that diagnosis in my clinical practice probably 50 times. And that, you got to go out to Emory and let Dr. Steenerson, who's a specialist, try and patch that oval membrane with a piece of a vein they take out of your leg, and I mean, it's a mess. So get you some Afrin and some Claritin D.
I'm glad I brought that up, because
take it before you land. You don't want to be.
The next time I fly, I'm definitely going to do that.
You don't want to be chewing gum and doing this and having a problem. You want to get where you don't have to do that.
Yes, I do.
All right.
Before we close, we always like to have a couple minutes. If there's anything you've researched or anything that you'd like to share, I mean, maybe something political. I never know with you. Let's just put it like that. I always like to have a good 2 minutes to open the door and say, how would you like to close this morning?
If I invest in something, you need to sell it short, because it's going to go down. All right. I've never made a good investment in my life.
Take him off the list.
Except my wife. I made a good.
I'd give you that one last chance.
I was going to give her. Made a great choice in a wife, and she's made some good investments. But anyway, I was shocked yesterday. If something goes up 1,000%, that's a huge number. Obesity in the world has gone up 1,000% outside the U.S. We're bad enough in children in 20 years. I was shocked at that. We talked about the soft drinks here a few weeks ago, and about Mexico putting a tax on the stuff, and about the tax on the sugary drinks. I'm shocked, stunned, and amazed. And this is not because kids are playing with their games instead of going out in the yard and playing cowboys and Indians. This is in parts of the world where it's not technology driven, but that's really a shock to me. In the children with diabetes and early heart disease in their 20s and stuff, it's scared the heck out of me. Anyway, and I wrote it down right there.
Dr. Whaley, I always appreciate it. I thank you so much. I learned so much. Our viewers, I'm not going to go into detail. One of our viewers called me last week after the show, and you said so many things that they shared with their granddaughter. So I just want to let you know, I don't want to go into it now, but I'll just say it had something to do with piercing, and we'll leave it there.
Yeah,
okay.
I understand.
So we're not going to get.
Okay, I did want to tell you about 2 weeks from now. I think it's the 27th or something. You're going to have a real good time here. Dr. Jennifer Jones, who's my partner, has been practicing oncology here in the mountains for 12 or 15 years. Is going to take my place because Ray's daughter, granddaughter, somebody's getting married, and I'm going to be at Parents' Weekend at Cornell University with my granddaughter, who doesn't have any piercings or any ink. So,
no.
Dr. Jennifer Jones will be here.
Well, we look forward to that. And Dr. Tidman yesterday, since he is not going to be able to be here, he did send me a joke.
I saw that.
Did you see that? Yeah. So no matter how much you push the envelope, it's still stationary.
Yeah.
Oh, okay. Thank you, Dr. Tidman. Thank you, Dr. Whaley. And especially thank you, Georgia Cancer Specialist. Right after these messages, folks, tune in your computer a little bit. May have to put the volume up. We do not do a lot of roadshow phone calls. So we're going to make this attempt with Congressman Doug Collins right on the other side of this break. And hopefully he could tell us what's going on in Congress, because can't really rely on the media. We'll be back right after these messages. Again, thank you. Thanks to Georgia Cancer Specialist. Taking a break, Ricky.